Hey guys, this is Ken. I'm in the hospital, as you can see, at St. Louis University Hospital. I just had a revision on a surgery that I had December 28th. I just want to make a short video about it. I would definitely want to give a big thumbs up to all the doctors and the hospital staff. They're all the greatest here. You couldn't ask for a better bunch of people. They treat me so good, and they're all so nice and very professional, and it's just nothing but the best here. It's actually a brand new hospital. They just opened it about 6-7 months ago. I recommend it to anyone. But I did want to talk about something earlier that happened to me. And what happened was I had my appendix. This was in 1990. The night before, I drank a little bit of vodka and some like screwdrivers, vodka and orange juice, and the next day I really was in bad shape. My stomach hurt really bad, my intestines, and I was just like balled up in bed. I got up and down a couple times. It was just so painful. And then my wife at the time took me to the emergency room, and they just gave me some antibiotics and pain pills and sent me home. So the next day I was in pain pretty bad again. My ex-mother-in-law, she called her doctor in Poplar Bluff actually, and he admitted me. I went to his clinic, and then he got me right in the hospital, and they got a surgeon. They removed my appendix, and as they were removing it, it bursted. So it dumped bacteria into my body, and they ran antibiotics through me for like 5 days, and just over and over and over, bag after bag after bag. It was like torture. But anyway, I made it through it, and I got a big scar. And the reason I brought it up is because a couple of these doctors here looked at me, and they told me right away that there was an emergency surgery because of the way they could tell by the scar. So I never really didn't know that. I know it's just kind of a big ugly scar, but whatever. I'm still alive. If anything ever like that happens to you, and you go to the emergency room and they send you home, what that did was mask the pain, and the antibiotics, I guess, and the pain medicine, kind of took it away for a while. But the doctor told me that I very well could have died from that. So that's it's a big deal. So just, if somebody, had those symptoms, then hopefully I'd maybe save somebody's life by telling them my experience. The little surgery I had went well. It's just a revision of something I had done December 28th, and I'm going to get into that later with the scar that's above my belly button. I want to touch base on the appendix, and then it's kind of a reveal, and it's something easy to talk about. So we'll get into that later, and it actually would be good for people to know, what's going on with me and how it all came about, what happened, because, it could be an early warning for someone and help them, stop them from possibly, having a progressive disease. So anyway, it's not been too bad. It's all good. We're hanging in there. So I want to comment on that, kind of give a little update about what's going on with me. Trying to get some videos out. Hopefully we'll get the boat going. I think I'm going to do a little video on the jet boat. We're actually working on K10 short wheelbase 4-wheel drive square body truck I have. It had some bad places on the paint. We're actually, my friend Dave came over, known him for about 40 years, and he's an ex-body man and paint guy, and so he did the body work on it, trying to fix the paint, get that painted. Then we're going to get on some other, maybe that Super B. I'd like to finish it. It needs to be done. I'll show you my scar. Okay, here's some of those scars I was telling you about. This is the one, my appendix scar. It's it's a little over 2 inches long, and you can tell it's, like I was talking about, the doctor said it was an emergency surgery. They could tell by the way it looked. It made this hole here because it got infected, and he had to take some peroxide and Q-tips and get in there and clean it up, so get that infection out of there. So that it kind of left a hole there. But then this one here is from the surgery that I'll talk about later, and that scar actually was part of this one, this one, and this one over here was all the same surgery. It was actually a robotic surgery. And then this one here was the one I had December 28th. That's part of the revision that they had to do this morning. I gained a little weight. You know, you have these surgeries and you can't really do anything. You're recovering, and in winter, and you know, you don't get out, and so I'm about 10 pounds overweight. I weighed in at 216 this morning. I'm 6'4.5". So it's a little bit of an optical illusion. My belly's not quite that big, but I definitely put on a few pounds. But I usually count my calories, but I got a little lazy. I'll get back on it. I was going to show you my face too, but right here, I was shaving, and I shaved a little patch of skin off, and I thought I just, you know, shaved a little too close, and it just kind of never would heal up. I actually got it healed up a couple times, but I mean, I've dealt with it for like 4 years, and I just kept, you know, being my own doctor. It did heal up a couple times. It was just skin over, and then it would pop back through. So I finally got some insurance. That's the reason I didn't go to the doctor, and one of the reasons, so that I didn't have insurance for the surgery. And but I finally got my insurance, and they got that taken care of. So they cut me all the way here, and then they took out all the cancer. It was a Basil Cell Carcinoma, which is a form of cancer. And then they had to take that flap and sew it back up there. So, you know, I got a big scar, but I kind of always wanted a big scar, so now I've got one. I actually had my, I got a scar on my back too, where I had my L5 disc removed, lower lumbar. I had a ruptured disc for years. That thing was agony. It burned, and just it really hurt bad. I get in the floor, couldn't get back up. I think what happened was that it bulged and it was like crooked, and so I was walking around all crooked and everything, and it got irritated even more. I didn't think it was ever going to straighten out. I went to the doctor, and they put me in surgery, and what was a Micro Discectomy. My scar was only 1 inch long, and they went in there with lasers, and they took out they cut the disc out and left a little piece around the spinal cord of the disc. It was kind of scary, really, and all that, and you have to lay down for 30 days. And scar tissue heals up in there, and but it's been good. I've been working. I'm a little bit limited, but not too bad. I mean, I've lifted some weights. I'm getting where I can't twist something, you know, like turning a big wrench and twisting it. Sometimes it scares me sometimes. I think, you know, maybe I should end up crippled if that little piece of bone slips and cuts my spinal cord in half or whatever, or damages it. It could be really bad. But we'll get into the latter one sometime soon. But I did want to discuss the appendix with you guys, and just tell you what a great hospital this is. St. Louis University Hospital is a big plus. You know, they just have the best equipment. They'll just run every test on you that they can. You know, I don't have a lot of money. I'm basically poor on Obamacare, but it's taking good care of me, you know. So I'm still here and kicking. So we're gonna make some videos. Hope you guys enjoy it. I'll get into this more recent stuff, you know, at a later date. It's kind of complicated, and it's pretty personal, but something I'm having to deal with now. And I feel good though. I mean, I'm tough, so you know, I hang in there, and I just keep putting one foot in front of the other, and you know, one thing about it, I try to stay active, and you know, and eat right, and try to stay healthy. So that's the main thing. I've got 4 doctors here at the hospital that I see on a fairly regular basis. So it's not fun, but you know, it's part of life. It's what you got to do. So we'll get into this later. All right, bye.